Hello, this is Dr. Rajat Bannerji, and I'm speaking from Rutgers Cancer Institute of New Jersey in New Brunswick, New Jersey in the United States. And at this ASH meeting, I presented updated data on the bispecific antibody odronextamab, which had previously been known as Regeneron 1979. The bispecific antibodies have shown activity in patients who've failed prior CAR T therapy, which in the United States is approved in the setting of lymphoma for diffuse large B-cell lymphoma that has progressed on at least two prior therapies. And so for patients who are subsequently treated with CAR T therapy for diffuse large B-cell lymphoma and then progress, treatment options are limited, and a number of patients are being referred to bispecific antibody clinical studies. At this ASH meeting, we've seen data on a number of bispecific antibodies, and I presented data on odronextamab in this setting. We present updated data at ASH 2020 with longer follow-up than what we had presented a year ago. And in this longer follow-up, we continue to see good activity and prolonged duration of response. Specifically, in patients with relapsed and refractory diffuse large B-cell lymphoma who have not had prior CAR T therapy at our active doses, which is 80 milligrams of odronextamab or higher, we see an overall response rate of 55% with a complete remission rate of 55%, and 83% of these patients had a durable response defined as maintaining a response for at least 3 months. And those responses are durable with the longest response to date out to 21 months. And these responses are ongoing. And that was the data in patients with diffuse large B-cell lymphoma who had not been treated with prior CAR T therapy. In patients with diffuse large B-cell lymphoma who had progressed on CAR T therapy and were then referred to the bispecific antibody study, again, at what we feel are our active lymphoma doses at 80 milligrams or above, we see an overall response rate of 33%, of which 21% were complete remissions. And of those complete responders, 100% maintained their complete remission up to the time of our data cutoff. So those CRs were ongoing with the longest out to 20 months. So again, we have activity in the post-CAR T setting, and of the patients who achieve a CR, those responses seem to be durable for the length of follow-up that we have so far.